Welcome everyone to our weekly Q&A session with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey. Thank you so much for joining us again today.
Of course, thanks for having me.
Absolutely. My name is Dilshad Burman. I'm a writer and reporter with City and 680 News, and I will be moderating this chat today. Actually, I should correct myself. We are now City News 680, not 680 News. We had a big collaboration on Monday, and so we're very proud of that. So pardon me, we're still all getting used to that. The way this works is we have been collecting your questions over the past week for the doctor, and she will be answering them today. She's never seen them before. It's all off the cuff. And if you haven't had a chance to submit your questions, you can still do so in the live chat in this broadcast. And we'll try to get to as many of them as we can in this short 30-minute period that we have with the doctor. So what we're going to do is we're going to start with our submitted questions. And usually we start with vaccine questions because it's still top of mind. Lots of people still deciding what to do. And then we'll move on to the other questions. So doctor, are you ready to go?
I'm ready.
All right, let's do this. So let's start with Wings. Wings is one of our regular contributors here on the AMA. They ask, are there any studies about the duration of the vaccine protection since the start of December 2020? If third doses are approved, do AstraZeneca double dose recipients take the mRNA or the AstraZeneca vaccine?
Okay, so yes, there are definitely studies. Ontario has an ongoing study with some great scientists from ICES that are continuing to monitor our vaccine effectiveness. And you can see that there has already been a recommendation in long-term care homes, congregate facilities for the elderly that they get a third booster dose. There is some early data as well from some of the other provinces that if you've had 2 doses of AstraZeneca, a third dose of messenger RNA might be preferred. Those that have had 1 dose of AstraZeneca and 1 dose of messenger RNA actually had a higher response compared to 2 doses of AstraZeneca. So the National Advisory Committee on Immunization is actively looking at this, as are individual provinces. So you can really expect in the coming weeks ahead, months ahead, that there may be recommendations if required. It doesn't necessarily mean that it is required for everyone, but it is being looked at.
Okay. And let's move on to Ash's question. Ash says, I already have joint pain issues and I am scared to get the vaccine. What if it worsens? There is no one to take care of me. One of the main side effects seems to be that people are getting tired and they have muscle pain even months after the vaccine.
Okay, a good question. Most people who get side effects like joint pains or muscle pains actually have very short-term side effects, really a couple of days, up to 3 days or so. And they don't last longer than that. Now, I think what you have to ask yourself is, what if you got COVID and you got a long COVID that it could impact your joints, your muscles, make you tired for a much, much longer period of time? That is actually a bigger risk. And that's why I would definitely recommend that you consider getting the vaccine.
Right, right. And then this one comes from Anonymous. Was there any news on the long-term safety of mRNA vaccines yet, or are we still 3 years away from finding out?
So we've only had the vaccine for a year, maybe a year and a half, if you include the clinical trials. I mean, we don't have 10-year follow-up related to this vaccine. We do know, though, that, the pandemic has been around since the beginning of 2020, at least in Canada. And we know that there have been many, many, many documented cases, maybe up to 10% of people who get COVID get long COVID.
Right.
And so those long-term effects are known of the infection itself. And the long COVID is very hard to treat. There is no one good treatment for it. People actually are struggling with their symptoms and can't seem to get back to their baseline normal. And so I think when we talk about theoretical long-term effects of the vaccine, let's compare them to the real long-term effects of a COVID infection that can be quite common. 10% of people who can get those.
Right, right. Okay, let's move on to Ash's question. Ash says, my 10-year-old son gets seizures. Is the vaccine safe for him?
So we right now don't have a vaccine that's approved for a 10-year-old. And so we'll have to wait to see what the safety data shows in terms of who it's recommended for. If it will be similar to, though, a 12-year-old or an adult, yes, even if you have seizures, in 12 plus, the vaccine is recommended for you.
Right. Okay. And then Jan asks, if people who got their vaccine in 2020, it's almost been a year since they got their vaccine, are they now back to, the same status as people who never got the shot?
No, not at all. There's certainly good evidence that even if you got your vaccine, it would have been late December 2020, if you got your vaccine, that, unless you're a resident in a long-term care home, the adults are still showing good vaccine effectiveness, even, many, many months later. But again, this is being looked at very closely.
Right. Okay. Now let's take Stasha's question. They ask, what does unknown vaccination status mean? You're either unvaccinated or you're vaccinated. Can you explain what that means?
Most people who have an unknown vaccination status are actually unvaccinated. They weren't able to verify with the client whether they were vaccinated or not. If you look in the vaccination registry that we have in Ontario, COVAX, there's no vaccination documented for them. Right. But until you actually ask the person and they answer the question, you can't verify that specifically. You also, a small proportion may have been vaccinated abroad as well.
Right. Okay. And let's go to Steve's question. Does a hospital patient have the right to ask for only vaccinated care workers to attend to their needs?
I can't really speak to what your rights are. I can certainly say, though, that there are many hospitals that have a vaccination policy for their staff and that are being implemented. If this is something that you would like to see in your hospital, I would say write to your hospital to say that this is something that you would like, that you would prefer. I mean, there's no question that as a healthcare worker, you're by nature of working in a hospital, dealing with people who are vulnerable. And I think we're starting to see many hospitals have vaccination requirements for their staff. Right.
Okay, Doctor, I'm not sure if you can answer this. It's kind of about the Arrive Can app, but I'll read it out anyway. Khalil asks, I was fully vaccinated in June and I made a 2-week trip overseas. Before coming back to Canada, I did the PCR test. It was negative. But before getting to Pearson, I tried to upload it to the Arrive Can app and it didn't work. And so he was told to quarantine upon arrival because there was no way of verifying his status. He was able to upload the data later to the Arrive Can app, but he's still receiving calls and emails to quarantine. Is there anything that he should be doing now?
So I think when you get a call from about your quarantine, you could ask them because I'm not quite sure the logistics of the Arrive Canada app. And so I would say reach out to the contact number. There is a contact number and email for travelers who return to try and get that sorted out. The other piece to note, though, is that some of the requirements federally for quarantine are based on the vaccine that you received. It sounds like you received vaccines in Canada, in which case they would be Health Canada approved. That does also make a difference for travel.
Right. Okay. And then let's go to Sean's question. Sean and Joe both have Israel-related questions. So let's take Sean's. Sean says, given the positive data out of Israel and other clinical trials, why not recommend boosters just for the general population? It would be consistent with what we know about the vaccine-induced protection to have a booster months later instead of 2 weeks for more durable protection.
Okay, another good question. I think, well, it seems like, Canada can be compared to Israel. Actually, it's not quite apples to apples comparison. Mm-hmm. So in Israel, they mostly used the Pfizer vaccine. They mostly used a shortened interval, so 21 days between first and second dose for their vaccines. What we're actually finding out in the research now is actually having that extended interval is actually beneficial to boost your immune response. And so 8 weeks, for example, we've talked about this before, but that the longer interval helps. And actually many Canadians had an extended interval, even up to 16 weeks. Yeah. And so that extended interval in Canada is likely playing an impact on why we're not seeing as much waning in Canada. It also means that most of the people have received their second dose more recently, like they've received it late spring, early summer. And so it hasn't even been 6 months since their last dose as well. So again, that's being looked at very actively, but it's not that we can look to even the US where they gave short intervals, or Israel where they gave short intervals, and say, well, because they're doing it there, we should do it here.
Right, okay. And then Joe asks, Israel studies have shown that unvaccinated immunity can be 6 times greater post-infection than that of somebody being jabbed without a prior infection. What are your thoughts on this?
So I think it's important to look at immunity, like tested through antibody levels versus actually getting reinfected or getting infection. And what we really know is that there's no what we call correlate of protection. You can't say if you have this level on an antibody, it means that you're going to have immunity for life or for 2 months or 3 months, whatever it is. And that's why we have to be very cautious when we just look at data on immunity, even related to boosters, just looking at antibody levels. We know after vaccination for most vaccines, actually your antibody levels drop. Okay. That's not uncommon in vaccines, but it does not mean that you're not protected. The detectable antibody levels may be lower, but then if you're exposed to the virus, your antibody levels go up and your T-cell immunity also kicks in. And so that's why we can't just say, look at antibody levels, and that means that you have, for example, long-term immunity.
Right, okay. And then Joe has a couple of questions, actually. Let's take this one because I haven't heard this before. Joe says, traditional vaccines, when injected, stay in your shoulder. This one doesn't, and it goes all throughout the body, and they found traces of it in the heart and ovaries, etc. Why is that?
So there actually is no evidence that there's traces of the vaccine all over the bodies. A lot of that is based on misinformation. The messenger RNA that is injected actually doesn't last in your body for very long. What it does do is it activates your immune system here in the arm, and then the activation of the immune system can certainly spread through your body. I mean, you have your immune system all over your body, and that is, what you'll find in other parts of your body. It's your own immune system that's been activated.
Right, that makes more sense, absolutely. Okay, let's go to this next question. Why is it that family practitioners cannot give you the shot, but you can get it at a local pop-up? Sorry, doctor, I thought that family physicians could give you the shot now.
Yes, if the family doctor is signed up to receive the COVID vaccine, they can give the COVID vaccine. Not all of them have been. There are some logistics related to getting the COVID vaccine in a family physician's office, some of which are not even related to the vaccine. It's about being able to record the vaccination into COVAX. Right. And we can see now that how important that is, having your vaccination in the electronic, because if you want to access it for your QR code, if it's not there, then you don't have that proof that you need for vaccination. So those are some of the reasons why not all physicians are on board right now, but certainly there's a lot of attempts to get as many pediatricians, family doctors to receive the vaccine.
Right. And just on that note, doctor, if this is not vaccine related, but we've got a live question coming in from JD right now on our website. Is there an online resource to find new doctors who are doing in-person visits? Because a lot of doctors are not seeing people in person, it's all virtual. And this is very important right now, they say.
That's a really good question. I'm not aware of a resource that specifies if you're looking for a doctor and that they provide in-person services. My recommendation is that if you have a physician already, to reach out to them and to ask them when, maybe certain times they may be providing in-person service or what their plans are, because there certainly have been recent letters written encouraging, assessing that in-person care. Now, not all care needs to be in person. I think we all recognize that, right? Some of it can be done over the phone. Some of that is actually easier done over the phone, but that's not always the case. And certainly there is really that value for that in-person care. And so with new guidelines that have come out from the Ministry of Health, hopefully that will actually help to enable some practices to provide that in the near future.
Right, especially considering that so many of us are vaccinated now, and we're taking all of the precautions. And as you've mentioned so many times, doctor, in even in dentist's office, like the PPE is required by all, medical personnel that is treating you. So I think all of those layers of protection are in place now.
Yeah, and in particular, with the coming weeks and the flu shot available, a lot of people get their flu vaccine at their doctor's office, including last year. And so that would be another great example for going in person to get that.
Yeah, exactly. Okay, let's jump back into our cache of questions. Okay. As someone who, Ilda asks, as someone who had COVID twice and both times recovered pretty well, why can't I trust my own immune system instead of taking the vaccine in order to have a normal life and travel and things like that?
So I think, it's great to hear that you recovered both times. And, I think that that's great that has happened to you. That's not always the case for everyone who gets COVID. I think it's a good example of how you can get COVID again. And I think that's one of the reasons why we still recommend people who have gotten COVID to get vaccinated, because we don't want you to get COVID again. Every time you get COVID, there is that risk for severe illness and for long-term complications from COVID. We also know that when you get COVID and you're unvaccinated, you're more likely to transmit more, have higher ability to transmit as well too. And so that's another good reason to get vaccinated.
Right. Okay, let's move to Kim's question. This is interesting. Kim has had 2 sets of side effects from the Moderna vaccine. She says, I'm 57 years old and I haven't had my periods for 11 years now, but I seem to be spotting every month now. And then in terms of the second shot of Moderna, I had laryngitis, and it's been chronic since then, since May, and it's now mid-October. So are these 2 conditions side effects of the Moderna vaccine, the spotting with the periods and the laryngitis after, which has lasted for months now?
So there's certainly not common side effects of the vaccine. Sometimes it's about determining, was it from the vaccine? Is something else going on? I mean, especially for a laryngitis that lasts for a long time, you might want to see your doctor to make sure there's nothing else going on inside your mouth. What I would suggest is that you ask your physician to make a report, an adverse event following immunization report, and report that to public health. You can also make a report as well too, because we can't always determine what we call causality, whether this caused that, but I think by reporting it, we can at least keep track of it to see if, other people are noticing this. But it certainly is not something that has been noted as being common.
Okay. And then Charlie asks, slightly long-winded here, so stay with me. Charlie had the shot 16 days ago and has been sick ever since, high temperature, joint stiffness, all of that. I had COVID back in February 2020 and I had 3 really bad days and it cleared up. I've been perfectly healthy ever since till I got the shot. And everyone says that the second shot is even worse. So should I be taking the second dose? And if I do, what can I expect?
Okay, so the first thing I would recommend is that you actually get a COVID test to make sure that these are actually symptoms from the vaccine and that it's not actually a new infection, because that can certainly happen. I mean, just because you're vaccinated, you don't get your immunity right away. It takes at least 2 weeks, if not longer. And so you want to make sure that this is not another COVID infection for you. There's no way to predict if after your second dose what your symptoms will be like. Sometimes they are stronger, but they're not always stronger in everyone. And so just because, if these really are side effects from the vaccine, just because you had them after your first dose does not in any way guarantee that they will be the same or worse after your second dose.
Right. Okay. Okay, let's jump into a live question coming in on YouTube right now. Daniel asks, when will Ontario release data like Alberta, which shows hospitalization versus the underlying condition?
So in terms of someone having a chronic health condition being hospitalized, so I think some of that information is available in some of the summary reports that are put out nationally, and you can check Public Health Ontario's website. They usually have a lot. I know that ICES also has some information on chronic health conditions as well.
Right. Okay. let's jump back into our cache here. Bernie asks, we already know that the vaccinated can get, carry, and spread COVID. My question is, if you get COVID from a vaccinated person, is it worse than you getting COVID from a non-vaccinated person?
Okay, so this is actually something that I'm trying to get more information on. How likely is a vaccinated person to spread COVID to another person? I've been connecting with my team that works in the school setting, and while there have been few people who have been vaccinated who have gotten COVID, we haven't yet been able to connect that they were spread it to anyone. And so that piece of being vaccinated and spreading COVID seems to be less. And certainly no indication that if you get a COVID from someone who's otherwise vaccinated, that it will be worse. Now, the one theoretical piece here is if you're vaccinated and you get COVID, you want to make sure that it's not a new variant. And that would be the one caveat, that if there is a new variant spreading and vaccinated people are getting COVID, if it's a new variant, well then, it's hard to know what to expect. But currently right now in Ontario, 99% of the COVID that we have is the Delta variant.
Okay. Okay, more live questions coming in from our website. Alan asks, I'm vaccinated, but my wife is not. Why would she be a threat to me in terms of getting COVID and I'm not a threat to her?
Well, it's actually really about probability and chances. And we actually know that if you're unvaccinated, you have a 5 to 7 times higher risk of getting COVID. And that's why, the unvaccinated carry that higher risk. We know also in the home setting that people bring COVID into the home and spread it in the home. Having a close contact or a household contact is still the highest reason why people are getting COVID. And that's particularly the case in children as well.
Mm-hmm. So I think, Doctor, actually, in terms of this question, and we've heard this a lot, it's basically, once again, comes down to, can the vaccinated spread it at the same rate as the unvaccinated? Do we have any data, any new data on that?
So the vaccinated, so again, less likely to get COVID, less likely to get severe COVID, and it seems also less likely to spread it. Again, there has been mixed data on this, but it does not seem that vaccinated who are getting COVID are spreading it in the same way. But more to come on that as more research comes out on that.
Yeah, for sure. We had that question.
Yeah, and to add, the Science Table yesterday released their letter back to the Premier on the recommendations for having hospital employees vaccinated, and did make a comment in there about hospital employees who are vaccinated who get COVID being less likely to transmit.
Okay, good to know. And then another question coming in on our website here. Are large sporting events and concerts a concern while kids under 12 cannot be vaccinated? We can clearly see people at hockey games with no masks on, and it's very concerning because those attendees go home to their kids and their kids then go to school, and then the cycle continues in terms of spread.
Yeah, I think this is something that we have to keep a close eye on as we reopen. I mean, all through the pandemic, we've been closing and opening and closing and opening, and taking time when we make a change to see, well, what's the impact on the spread of COVID. In those settings, while it's fully vaccinated among 12 plus who can enter, the children who are less than 12, yes, they can still attend with their parents or maybe at home, but still recommended that you wear that mask, right? Don't come if you're sick. All of those things, again, to slow the spread if there is COVID in those settings. But we're going to have to wait still a few more weeks to see the effects of having those large events and what impact they may have on our COVID numbers. Right.
And doctor, then when it comes to, God forbid, but if it happens that there's spikes because of these events and things like that, will TPH then recommend that the province scale back on these things?
We're certainly always providing, having conversations with our provincial colleagues. I can certainly say that some of those sporting events started the end of September, and our rates in Toronto, even in Ontario, have had a slow decline, actually. So we are still continuing in the right direction, despite having some of these venues opened. I think there's no question that vaccine certification makes a difference in these settings.
Absolutely. Okay, let's take a question from YouTube coming in live. Ronald asks, why not just ditch all of the tests and do one T-cell immunity test?
I'm not sure that we have a commercial T-cell immunity test. I know that there have researchers that have done some of that testing. Again, we don't have one that's available that very clearly shows that, you know, if you score this on your test, it means that you have this kind of immunity. That is certainly not available just yet.
Okay, and we'll take another live question coming from Facebook here. We've actually had this question even in our submitted questions. What are the labs using now in their PCR test as a cycle rate? Has it changed since Jan 2021, or is it still at 35 to 40? Lots of PCR question tests this week, actually.
Okay, so the cycle threshold, it's usually, you know, around 30. That's usually what we look at, but it varies depending upon the lab. So technically the lab should be giving a reference range for what it considers to be above or below a certain number.
Okay, and then let's see, we'll jump back into our cache, but I see some more live questions coming too. Andrew asks, why does my arm hurt 3 months after getting the shot?
Oh, I'm sorry, Andrew, that your arm hurts. You know, sometimes it can be that your nerve got irritated or that your muscle got irritated from the vaccine. So it could be something like that. You could certainly see your doctor about it. You want to make sure that there's nothing else going on as well. And then also to find out treatments that you could have. Right.
Okay. Okay, we'll take this question. I'm not sure, doctor, if you can answer it, but George asks, coming in live on our website, if the vaccine doesn't stop transmission, why are unvaccinated employees getting fired, in particular those who can work remotely?
So the vaccines reduce transmission by a large proportion. And the goal of the vaccination program is to prevent hospitalizations, severe illness. It's to preserve our healthcare capacity. You know, those are all really important reasons. And we're in the midst of a pandemic. You know, vaccines are not 100%. I mean, I don't think any of us said that vaccines were 100%. And that's why we still have masking, physical distancing in most places, you know, all of those other measures in place to continue to work with vaccines to prevent the spread.
Yeah. And doctor, I think in terms of employers, you've mentioned several times that every employer can make their own policies regarding vaccination. So I don't think it's something that's provincial or even, you know, even municipally based. It's based on each employer.
Well, some of it is provincial. So for example, in long-term care homes, that is a provincial directive, for example, yes. But as an employer, by having your staff vaccinated, it will actually ensure that your staff will be there to continue to work, that it will keep them healthy. I mean, there's no question that the vaccines can promote a safer workplace as well.
Yeah, absolutely. So we have only 1 minute left, and I'm going to jump in with this non-vaccine related question. RT asks, are daily case counts and school counts separate? 306 daily cases, but 269 were school cases. If these numbers are all together, that means it's pretty much all school children that are getting sick?
Okay, yeah, good question. It's not always harmonized. So the daily case counts are based on the cases that are reported to the health unit on that day. The school cases are based on the cases that are reported by the school boards to the Ministry of Education. And so sometimes there may be delays. It could be that the Ministry of Ed is reporting before the public health unit. And so it's not always harmonized day over day.
Right. Okay. And it could be that the daily cases are today's cases, but the school cases might be accumulated over a little period of time. I believe that's how the reporting works. I'm not quite sure though.
That's right. Or it could also be that the school cases are reported before they're even reported to public health, because public health requires the lab report coming from the lab to be reported to public health. And sometimes parents will find out on their own. They'll look up online. And so the principal may actually get the report before even public health does.
Okay, okay. That brings us to 1 o'clock. Doctor, thank you so much for taking the time and having the patience to answer all these questions for us. Thanks to everybody that submitted live. That was a really great interactive session. We will have the doctor back next week in case we didn't get to your questions. So please tune in again. For now, we'll say thank you and goodbye. Bye, doctor. Thank you so much.
Bye.